Oh, I've been down and out with COVID, my listeners. Do you know, being the researcher and the lover of research that I am, I had to look into this. I had to explore the impact of COVID-19 on menopausal women and see if estrogen plays a protective role in that, specifically, making a case for HRT perhaps. So that's what I did. Welcome back to another episode of All Things Menopausal. And today I am looking at that unique cross-section between COVID-19, long COVID, and hormone replacement therapy or menopause hormone therapy, MHT. And if it does have any role in managing our symptoms. Okay, before we go any further, I will say my biggest prolonged symptom since I came down with COVID on June 12th is this crazy incessant cough and heaviness on my chest. My family also had it, but for me, it's just lingering. I was getting quite worried. But I've done enough research into HRT and understanding its protective mechanism and anti-inflammatory properties. But let's just go a little deeper into this, shall we? So, of course, I'm sure by now, COVID-19, the pandemic, has affected everyone. Certain groups, however, are more vulnerable to severe outcomes. And among the groups are older women, post-menopause women, in particular women with compromised immune system. But I thought, post-menopausal, okay. Yes, recent research highlights the significant role that estrogen plays in mitigating the severity of COVID-19 symptoms on this unique demographic. So let's start with some background. And I did research. I have quoted research papers all in the show notes as well. You can read some more about this in my blog post of the same name. And research is finding that postmenopausal women will experience more severe COVID-19 symptoms compared to their pre-perimenopausal counterparts and also age-matched men. For example, a study that was done by a researcher, Peter Frigo, found that postmenopausal women had longer hospitalization times and more severe disease courses. This increased severity is attributed to the decline in estrogen levels, which plays a significant role in our immune response. Interesting. Why is that? Well, estrogen is known for its immunomodulatory properties, meaning it can enhance the body's immune response to infections. Here's another research study done by Ricardo Costillera, I'm sure I pronounced that wrong, and his colleagues that found that premenopausal women and those undergoing hormone replacement therapy showed slower rates of severe COVID-19 symptoms. The hormones, they help in mounting a stronger immune response, which is crucial in fighting viral infections like COVID-19. Okay, I have been on my own hormone replacement therapy, I would say for just close to 5 months, if not more. And by the third month, I started to experience improved sleep and cognitive function. The brain fog had dissipated and my forgetfulness was less frequent. But when COVID hit, these symptoms came back along with other very similar symptoms to menopause. And we're talking the memory loss, the extreme fatigue, the headaches, and a general sensation that I was totally spaced out. However, this time it was far different in intensity. So I began to wonder then if my own HRT was a help or a hindrance. And here's what I found. It comes down to estrogen's influence on inflammation in the body. And I did a podcast about this not too long ago, menopause inflammation, as well as a blog post. One of the critical aspects of COVID-19's impact in the body is our inflammatory response. But estrogen helps modulate this response by reducing the levels of pro-inflammatory cytokines. They're necessary. They help fight off infection and disease, and their role is also to send messages to coordinate the body's immune response for fending off attackers, such as the COVID virus. There was a study conducted by a team of researchers found higher estrogen levels were associated with lower levels of these pro-inflammatory cytokines in the body, thereby, of course, reducing inflammation and potentially preventing severe respiratory complications. So if the research postulates hormone therapy is beneficial, it could be that what I'm experiencing, albeit worse than when I was first inflicted with the virus during the lockdown era, is actually far less intense than it could be if I wasn't on HRT. So it's pretty scary to think that those women who are not on HRT are being misdiagnosed for perhaps other ailments or altogether, or for long COVID, or that her menopausal symptoms are being overshadowed by this virus, then just how intense could they be suffering? Long COVID, first and foremost, it's important to understand, is a condition where the symptoms of COVID, they will persist for weeks or months following an acute COVID infection. And this presents significant health challenges, respiratory issues for one. Long COVID is showing up on average in individuals who are 46 and a half years old, and 83% of them are female. This is findings from a study by Dr. Louise Newson. She's one of the leading experts in the field of menopausal health. Love her. She also has her own podcast, and I'll get that in the show notes. Her study also found, in 2021, that 36% of the women reported disturbances in their menstrual cycles. So interesting, this overlap of symptoms between long COVID and menopause raises important questions about just what the role of hormones are and the potential for misdiagnosis. These findings, they also highlight the necessity for healthcare professionals to consider hormonal changes when treating women with long COVID, and proper diagnosis and management, including, well, of course, HRT, could significantly improve patient outcomes. I find that fascinating. I find this fascinating because it makes me think of those clinics that are focusing on long COVID, and that's good. That is definitely a good thing because of the fact that this virus continues to persist and is causing all kinds of health issues as a result. But just how much emphasis is being put on the long COVID and overlooking the fact that women at age 46 are right at the average age for perimenopause. And then furthermore, with that misdiagnosis or this overshadowing of the COVID virus and completely missing the symptoms of menopause altogether, how much of a disservice are we providing in the healthcare system to menopausal women? And that's why I really want to help women, empower women with knowledge so that they can advocate on their own behalf when they have to have those conversations with their doctors. And just kind of debunk those mistruths and unweave some of the tangled information around COVID and menopause. And how do I do that? Well, I turn to the research. For example, another article highlights that patients suffering from long COVID symptoms have a significant hormonal trends, including reduced estrogen levels, and that these hormonal imbalances could exacerbate the already challenging symptoms of long COVID. Oh, and it gets better. A study done by Alessandro Lamy highlighted that postmenopausal women experienced heightened anxiety and depression during the pandemic. And of course, we all know that the pandemic's impact did extend beyond just our physical health, and it affected so much of our psychological well-being, from depression, anxiety, loneliness, suicidal tendencies even. But when we look at it through the lens of menopause and the menopausal woman's experience, there has been enough findings to show that COVID-19 virus exacerbated the physical symptoms of menopause, such as hot flashes and night sweats. Again, another argument that shows that estrogen replacement therapies are able to alleviate some of these physiological symptoms and psychological symptoms, emphasizing that the hormonal's overall protective role in the body shouldn't be dismissed, if you will, when treating long COVID. So just what is the overall role of hormone replacement therapy, particularly when it comes to fighting long COVID symptoms? Well, this is an area that still remains very active. And of course, it's only been a couple of years, so there's so much more research to come out of this. All that to say, we continue to move the yardstick on research. Science marches on, and while I personally am not here to preach HRT, as those decisions rest with my clients and their healthcare team, the evidence is clear that the benefits of hormone therapy far outweigh the risks. The truth is, much of the negativity regarding HRT stems from the misinterpretation of the Women's Health Initiative, the WHI study in 2002, which led to a mass reduction in HRT use around the globe. But as a doula and a menopause champion, my aim is to empower women with information on leading research, credible data, and of course, reliable studies so that they can present their case to their healthcare provider and advocate for menopause symptom management strategies that improve quality of life. And that is the key right there, quality of life as the gold standard in her personal care. But there are other holistic approaches to consider as an alternative or to complement HRT, and these include nutrition, movement, sleep management, and stress reduction. And I speak extensively to this in previous podcasts with guest experts and in solo podcast episodes and in several of my blog posts. So go check that out. But my last solo episode in particular focuses on inflammation and how addressing it goes a long way in keeping the immune system in check. And while it may not fend off all viruses, it can aid in COVID symptom management. It certainly did for me. I kept committed to regular habits such as avoiding sugary foods and simple carbs, which our body tends to crave when we're feeling sick, and certainly alcohol. And I could advocate at great length on why we in menopause should not be consuming alcohol. Staying hydrated, which alone merits a podcast episode of its own. And then, of course, getting our nutrients and vitamins through good food sources, which are essential to good health and gut health too, the gut microbiome, and maintaining immunity strength. And then, of course, sleep and keeping cortisol levels manageable. And I have some great guest experts coming up in these summer months to talk about nutrition through our food sources, vitamins, nutrients, and I can't wait to share those with you. So stand by for that to come out in the next few weeks. So in conclusion, the research underscores the significant impact of menopause and estrogen on COVID-19 outcomes in menopausal women and postmenopausal women. Estrogen's role in enhancing our immune response and reducing inflammation highlights the protective effects against severe COVID-19 symptoms. And the potential of HRT in managing long COVID symptoms offer a promising avenue for supporting postmenopausal women. So as we continue to navigate these challenges, the findings that are from the research I looked into, all in the show notes, could inform targeted interventions and therapies to support the health and the vitality of menopausal women, and ultimately reduce the virus's overall burden on this unique demographic. Well, I hope you enjoyed another episode, a solo episode from me, Mary, your host on all things menopausal. And if you find these discussions helpful and insightful, well, flip me a note or consider subscribing to the podcast. And you can find that in the show notes. To click to subscribe. It goes a long way in producing these episodes and bringing on some amazing guests. So until next time, my lovely listeners, love and light. Do you need support through your menopause transition? A menopause doula can help. You can find me at mlcoaching.com. And help me help you by filling out a simple survey, which is linked in the show notes. Your input is greatly valued and will help in the design and creation of tools, courses, and other resources for my upcoming one-on-one and group coaching programs. Take the survey, it's linked in the show notes. Like, follow, share, subscribe. And if you are enjoying this podcast, I would love to hear from you. Consider leaving a review. Spreading the word will help broaden my audience reach and further impact more women as they experience a transition.